specifically testing patients deemed to be most likely to have H1N1 flu, based on symptoms and risk factors, such as travel to Mexico. It's unknown what patients who tested negative for flu were actually afflicted with, since the illness was not otherwise determined. Health experts say it's assumed the patients had some sort of cold or upper respiratory infection, that is just not influenza. With most cases diagnosed solely on symptoms and risk factors, the H1N1 flu epidemic may seem worse than it is. For example, on September 22, this alarming headline came from Georgetown University in Washington, D.C. H1N1 flu infects over 250 Georgetown students. H1N1 flu can be deadly, and an outbreak of 250 students would be an especially troubling cluster. However, the number of sick students came not from lab-confirmed tests, but from estimates made by counting students who went to the student health center with flu symptoms, students who called the H1N1 hotline, or the health center's doctor on call, and students who went to the hospital's emergency room. Without lab testing, it's impossible to know how many of the students actually had H1N1 flu. But the statistical trend indicates it was likely much fewer than 250. CDC continues to monitor flu in general and H1N1 through sentinels, which basically act as spot checks to detect trends around the nation. But at least one state, California, has found value in tracking H1N1 flu in greater detail. What we are doing is much more detailed and expensive than what CDC wants, said Dr. Bella Matias, California's acting chief of emergency preparedness and response. We are gathering data better to answer how severe is the illness. With CDC's fallback position, there are so many uncertainties with who's being counted, it's hard to know how much we are seeing is due to H1N1 flu rather than a mix of influenza diseases generally. We can tell that apart, but they can't. After our conversation with Dr. Matias, public affairs officials with the California Department of Public Health emphasized to CBS News that they support CDC policy to stop counting individual cases, maintaining that the state has the resources to gather more specific testing data than the CDC. Because of the uncertainties, the CDC advises even those who were told they had H1N1 to get vaccinated unless they had lab confirmation. Persons who are uncertain about how they were diagnosed should get the 2009 H1N1 vaccine. That's unwelcome news for a Marietta, Georgia mom whose 2 children were diagnosed with probable H1N1 flu over the summer. She hoped that would mean they wouldn't need the hastily developed H1N1 flu vaccine. However, since their cases were never confirmed with lab tests, the CDC advises they get the vaccine. I wish they had tested, and that I knew for sure whether they had it. I'm not anxious to give them an experimental vaccine, if they don't need it. Speaking to CBS's 60 Minutes, CDC Director Dr. Frieden said he has confidence that the vaccine will be safe and effective.
We're confident it will be effective. We have every reason to believe that it will be safe.
However, the CDC recommendation for those who had probable or presumed H1N1 flu to go ahead and get vaccinated anyway means the relatively small proportion of those who actually did have H1N1 flu will be getting the vaccine unnecessarily. This exposes them to rare but significant side effects, such as paralysis from Guillain-Barré syndrome. It also uses up vaccine, which is said to be in short supply. The CDC was hoping to have shipped 40 million doses by the end of October, but only about 30 million doses will be available this month. The CDC did not respond to questions from CBS News for this report. End of CBS article.